Welcome to the MD Edge Daily News for Friday, July 20th. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, deaths from liver disease in the U.S. have surged since 1999.
And the bivalent HPV vaccine brings no significant increase in 38 potential adverse outcomes.
And later, nearly 1/4 of pre-surgery patients are already using opioids.
But we begin today with participation in Medicare's bundled payment initiative. Bundled payments did not significantly change per episode or care outcomes for the top 5 medical conditions selected under the program. This is according to a new analysis published in the New England Journal of Medicine. Payments for the common conditions remained around $24,000 per episode before and during participation in the bundled payments for Care Improvement Initiative. That includes the 125 participating hospitals evaluated in the analysis. The finding by Dr. Karen Joint-Maddox and her colleagues contrasts with previous research that shows that hospitals in the bundling initiative successfully lowered all Medicare payments for patients who underwent joint replacement. The Center for Medicare and Medicaid Innovation initiated the Voluntary Demonstration Project back in 2013. It targets 48 conditions that account for 70% of Medicare spending. This study focused on Medicare claims between 2013 and 2015 for 5 common conditions: congestive heart failure, pneumonia, chronic obstructive pulmonary disease, sepsis, and acute myocardial infarction. The researchers compared a group of hospitals that participated in the initiative with a control group that did not. The baseline payment amount was just over $24,000. Hospitals that participated in the initiative had a payment reduction of $268 compared with a $400 reduction for hospitals in the control group. Dr. Joint-Maddox of Washington University in St. Louis says that despite the importance of episode-based payment, there has been little research examining its efficacy or determining whether it has unintended consequences. As an example, she says that hospitals could be selecting patients with relatively less complex conditions to reduce costs and improve outcomes.
Deaths from cirrhosis of the liver increased by 65% between 1999 and 2016, and deaths from hepatocellular carcinoma more than doubled. This is according to new research by doctors at the University of Michigan. The study, published in the BMJ, extracted data from the Vital Statistic Cooperative and the CDC. The investigators examined raw mortality and analyzed the data for demographic and geographic trends. In 1999, more than 20,000 people died from cirrhosis. That number ballooned to nearly 35,000 in 2016. The research shows men were twice as likely to die from the disease. Individuals between the ages of 25 and 34 had the largest increase in mortality, which was directly driven by increases in alcohol use disorder and alcohol-related liver disease in this age group. Native Americans had the highest mortality rate, which was more than double the next closest ethnic group. With regard to hepatocellular carcinoma, 5,100 people died from the disease in 1999, compared with more than 11,000 in 2016. Men were 4 times more likely to die from this condition. The increase was most notable in older patients, while mortality decreased in patients under 55. Asians and Pacific Islanders had the highest mortality for hepatocellular carcinoma.
Human papillomavirus vaccination is not associated with significantly higher risk of any of 38 potential adverse outcomes. This is according to a retrospective study of Finnish girls between 11 and 15 years old. The study was presented at the European Society for Pediatric Infectious Diseases. Finland introduced the bivalent vaccine, known as Cervarix, into the national vaccination program in 2013. Cervarix is detected against HPV types 16 and 18. The target age for vaccination of girls is 11 through 13, with catch-up vaccination ages at 14 or 15. The researchers report that only 56% of the target population was actually vaccinated, between November 2013 and December 2016. They compared adverse event outcomes and found that vaccination was not associated with an increased risk for any of 38 outcomes ranging from celiac disease to lupus. On the contrary, vaccination was associated with a significantly reduced risk of several conditions. For instance, the risk of chronic fatigue syndrome was reduced by 25%, epilepsy by 28%, and Hanoch-Schönlein purpura by 52%. The researchers also note that the 400% increased risk of Guillain-Barré syndrome seen in vaccinated children was not statistically significant. They report only 6 cases for about 190,000 person-years of follow-up.
Finally today, preoperative opioid use was prevalent in nearly 1/4 of patients set to undergo surgery at the University of Michigan Health System. This is according to a cross-sectional observational study published in JAMA Surgery. The researchers note that they sought to specifically examine a more detailed profile of both the characteristics of these patients as well as the types of procedures that are correlated with preoperative opioid use. The data come from the Michigan Genomics Initiative and the Analgesic Outcomes Study. More than 34,000 patients were recruited for the study. Nearly 90% were white, and the mean age was 53. Overall, 23% of patients were taking opioids of various kinds. In a multivariate analysis, the researchers report that risks for pre-surgical opioid use included being 31 to 40 years old, tobacco use, heavy alcohol use, pain score, depression, and certain comorbidities. In looking at procedure correlation, patients who were scheduled for a lower extremity operation were at the highest risk for preoperative opioid use. The study also breaks down the pre-surgical opioid use by surgery service. Of patients having spine neurosurgery, 55% were already taking opioids. And among those having orthopedic spine surgery, 65% were taking opioids, while general surgery patients were not among the most likely to be using opioids. Dr. Michael Inglesby of the University of Michigan is a co-author on the study. He says that patients should expect to be in pain after surgery. If a patient has a complex pain history or takes chronic opioids, surgeons should consider referring them to anesthesia for formal pre-op pain management. And that concludes the MD Edge Daily News for this Friday. Links to these stories can be found in the podcast description as well as online at mdedge.com. Until next time, I'm Mary Ellen Schneider.
And I'm Nick Andrews. You can subscribe to the Daily News wherever you get your podcasts. From all of us here at MD Edge, have a happy, safe weekend.